Hey, this is Dr. G, the geriatrician and lifestyle medicine expert. This post is going to follow my YouTube short talking about cholesterol and how it's not just a number. Check out the blog geriacademy.com for more information on aging related topics and subscribe to my channel if you like this video. But I wanted to talk about cholesterol in terms of the stuff that's normally checked, like LDL cholesterol, that's known as bad cholesterol. High levels are associated with heart disease. HDL-C, generally known as good cholesterol, but sometimes too high of an HDL-C can be bad. And triglycerides, those are bad too because they can cause atherosclerosis in the vessels. What I really wanted to focus on are these small densities, so these smaller particles that are generally not checked by most primary care docs. So ask your doctor to check these if you have abnormal cholesterol levels. The first one is ApoB, apolipoprotein B. It's found in those LDL particles, and higher levels increase your risk of plaques in those vessels and increase the risk of cardiovascular disease. ApoA1, that's apolipoprotein A1. It's found in HDL particles, and this is actually, remember, the HDL is good. So lower levels of this can increase your risk of cardiovascular disease because those HDL particles help carry away bad cholesterol. And then the small density lipoproteins, it's highly atherogenic. Again, that means plaque buildup in those vessels. And smaller particles penetrate the arterial walls and more prone to inflammation and causing cardiovascular risk. And very low density lipoproteins. These transport triglycerides from the liver to the tissue. So very low density lipoprotein equals high triglyceride levels. And so increased VLDL can lead to small, dense LDL particles and also insulin resistance. There's also some other labs that we check. I like the lipoprotein A, the LPA. That one is a genetic risk factor. High levels are associated with an increased risk of atherosclerotic cardiovascular disease. Again, that's plaque building up. When my patients have a high LPA, I might order a CT scan to look at how much calcium they have deposited, and my treatment approach may be a little bit different for those patients. A BNP, not everyone needs a BNP, but that can help assess heart failure, and elevated levels can also indicate cardiac stress, so heart stress and dysfunction. And when we're checking for heart disease, we have to think about blood sugars too. So I usually will check hemoglobin A1C levels, which gives us an average blood sugar level over the last 3 months. I check fasting blood sugars, and since I'm not talking about all the blood sugars, I might also check things like labs for insulin resistance, fasting insulin. I might even put my patient on a continuous glucose monitor for a couple of weeks and track their diet to see what their blood sugars are doing. I also look at cholesterol ratios. I think it's really important because you have good cholesterol compared to bad cholesterol. And so total cholesterol compared to HDL cholesterol, triglycerides to HDL cholesterol, LDL cholesterol to HDL cholesterol, these provide sort of an understanding of how the body is carrying out the bad stuff. And then I also check inflammatory markers. So high sensitivity CRP, it's a marker of inflammation. High levels are linked to an increased risk of heart disease and stroke. Now, sometimes patients can have high levels because they were just vaccinated, or they may have had some type of an immune issue or an infection like the flu. And so it's always important to recheck those levels if they're not routinely elevated in patients. I check something called an interleukin 6, a pro-inflammatory lab. But again, this may not be valid if the person is sick. And some other more cardiac specific markers that I check is the Lp(a)2, And this is an lipoprotein associated phospholipid. So this produces inflammatory cells associated with those LDL particles. And high levels suggest that there's inflammation in the vessels and possibly more plaque instability. And you want to check these when we really have an unclear understanding of cardiovascular risk in a patient, if there's family history of early heart disease, or they're having persistently elevated LDL and ApoB despite us treating them. And then the OXPL ApoB, this is a marker for oxidative stress. So basically stress and inflammation in the body. And it matters, we check these when the patient is prone to rupture of a plaque. So if we think that they have plaque in their vessels. And we want to check these when patients have suspected risk after we've already started them on a cholesterol medication, or a history of a premature cardiovascular event, or if they have an elevated LPA or chronic inflammation. There's also HDL mapping. I like to look at a person's HDL map. Not all HDL is the same, even though we think HDL is good cholesterol. It looks at the size and the function of those particles. It matters because larger, more functional HDL particles are more protective, and the small, dense HDL may be less protective in removing cholesterol. It helps me to evaluate for cardiovascular risk when an HDL level is maybe normal, but it might not be normal, or when I'm worried that somebody might have a metabolic issue or diabetes. And I also check something else called a cholesterol balance, and it measures cholesterol absorption versus production. So some people actually produce more cholesterol, and some people actually absorb more cholesterol. And so treatment should be different for those folks. And when we have a high absorber versus a high producer, I might choose a different medication for them or a different dietary plan for them. And I check this when the when the LDL is high despite starting them on a statin. And I also really check it because of personalized lipid management strategies. I can give patients more specific dietary recommendations. And that's basically most of the cholesterol labs that I check in my practice. You may want to ask your doctor why they are not checking them. There may not be a reason to check them for you. I hope you find these posts helpful. I just want to make sure that people have access to all of this information. Subscribe to my channel if you find these posts helpful.